Hey, it's Nikki or Beach with my babies. This is my first day home from the hospital after having a lower body lift. And I thought I'd update everybody as far as kind of what happened over the last couple days. I had to go into the hospital at 5:30, let's see, not yesterday morning, 2 days ago. I know, time's a little bit crazy. 5:30 in the morning. And I was getting prepped. I have a hard time getting IVs, so they had to try a couple times with the IV, which was no fun. I got IV'd. Anesthesiologist put me to sleep in the prep room, so I was able to go to sleep with my husband next to me, and then they wheeled me into surgery. The next thing I remember, I'm waking up in recovery. I had actually a really awful recovery nurse who one didn't read my chart and two didn't know what was going on, so he kind of just neglected me for the next 6 hours, which was not good. When I woke up, I had a piece of triangular foam between my legs, so I couldn't move my legs. My legs were tied down because they didn't want me to stress any of my stitches. And what else was going on? That's about it. I had some issues with nausea, but that I knew I was going to have because of the anesthesia. Anyway, finally, after at like 7 p.m., I got out of surgery, I think at like 1:30-ish, 2 o'clock. Surgery started about 9:30, 10 o'clock. I got a room finally at like 7:30, 8 o'clock in the evening and got away from that awful recovery nurse. And the only reason I say that he's awful is because I was his only patient and he would leave the room for like 40 minutes at a time. I ran out of water. My husband had to get me my own water. I ran out of IV fluids. The guy was an idiot. Anyway, I got into my room and I stayed in bed. The biggest point of pain really is your tailbone. My sutures are all pretty numb, but the tailbone was pretty sore because I'm sitting on it the whole time. So I spent that whole kind of first night. They tried to prop me up, but because they couldn't fit me on the plastic surgery floor, I was on the floor where they deal with kidney patients, kidney transplants, and dialysis. And they didn't totally know. I have a pain pump, which I won't show you because right now it's hooked up to all my drains and stuff, but they didn't know what that was, and there was a lot of confusion. So generally, my initial experience was pretty bad, just because no one seemed to know what they were doing. Ah, thanks, American medicine. But I can be happy to say that the night nurse that I did have was a really, really nice guy. He was trying his hardest to figure out what he needed to do for me, things like that. Um, I called the charge nurse, that he was my shift nurse, who was primarily with me. Charge nurse, I nicknamed Miss Cratchit, or Nurse Cratchit, because she was awful. I had to hit the button a lot because my neighbor's alarm kept going off. I had a woman next to me who had a mastectomy, and her alarm kept going off, and she didn't speak English. So I kept hitting the alarm, the nurse page, and I guess the nurse thought I was being obnoxious. Anyway, so stuck up for myself there a little bit. In the morning, I had the world's best nurse ever. Not that my male nurse the night before was awful, but he just didn't stand up to Nurse Cratchit. I call her Nurse Cratchit because she had to flush my IV, and she just slammed like a bunch of fluid as quickly as possible into my IV tube, and it hurt really bad. And then when I started crying, she didn't even make eye contact with me. She was a brat. So start off with a pretty negative experience at the beginning. Next day, my discharge papers were up at 7 a.m. However, I hadn't walked yet. I still had a catheter in. My nurse the next day was awesome. She was like, "You're not going anywhere." So we worked together. The first time I tried to sit up, my blood pressure got real low, and I had a hard time breathing, and I felt like I was gonna black out. So we laid me back down. I think primarily the big part of that was I had no food in my system. I was on a clear liquids diet, and for the past like 48 hours at that point, all I'd had was a couple things of Jello and some broth. Um, so I was really weak, and so we got some food in me. I dreamed all night of oatmeal, and then my nurse, who was the best nurse ever, this next day, brought me oatmeal with some sugar, which was just like heaven. So I had oatmeal and that was amazing, and my pain meds, and I took a good rest. So then I tried later on, we paid physical therapy, and I worked with a physical therapist to get up, and I learned how to roll myself in and out of bed and walk. I'm walking right now with a walker. I look probably like I'm 97 years old walking with my walker. I can't stand up straight. I'm pretty much folded in half. It's really, really tight. I'm swollen all over my legs and my hips and my butt. So I'm having a really hard time get kind of moving. But the walking's good. It's causing the fluid to go down, and I know the more that I walk, the better. So um, I can't say that it's been easy with the pain. The pain's been pretty intense. And a couple times my pain meds had kind of lapsed with the crappy nurses, and I was crying and kind of shaking a little bit. Um, my pain's better maintained now, and I'm up on my couch right now. I've been laying flat in bed all night. I slept pretty good. Um, I can tell you right now, the best thing I ever took to the hospital, this eye mask, okay? It's by Bucky. I don't know if you can see right there. This thing was awesome. I used this all night. Um, all day, blocked the light out. It was comfortable. It's got these like pads. So I used that last night. I used it in the hospital with my earplugs. It was a godsend. So if I could anything that I took to the hospital, that's the one thing I highly recommend. It's an eye patch, a very comfortable eye patch that's soft and easy for you to sleep with, and some earplugs. I didn't really use anything else. I've been really diligent about getting my fluids in, and uh, staying. I was pretty dehydrated when I got out of surgery, probably because I lost a lot of fluids during surgery. Um, but I've got my catheter out. I've been going to the bathroom. I've been walking around a little bit. But like I said, pain's pretty high right now. Swelling's really high. I've got very limited movement in my back and my hips. But thank God my legs are really strong and my biceps are really strong, because using that walker, I've been using my biceps and my quadriceps to really get me around everywhere. Um, so if any of you are thinking about the surgery, and you want to do anything in the gym to prepare you, if you're not quite at your goal yet and you know you've got a couple months to a year before you're going to have the surgery, I highly recommend building your quadriceps up, building your biceps up. I've been doing the dip with with your two hands. When I'm pushing myself up on my walker, I am doing that motion an awful lot. So my biceps are getting very fatigued. My quadriceps are getting very fatigued when I'm walking. And I have really strong biceps and quadriceps. Okay, probably arguable with the biceps, but my quads are really strong. And we were all commenting on how this must be really difficult for people who don't have that physical strength, because you are supporting yourself completely by your quads and your biceps. You really can't use your core much at all. So anyway, so that's my first update. Sorry, it's kind of boring. I'll update you more. I don't have a restrictive garment on. My doctor doesn't believe in the compression garments, so I just have my drains. I have a pain pump, which is pumping numbing fluid to my abdominals and my rear to keep that more comfortable. And I'm having my first cup of decaf coffee with milk, and it's heaven. I'm getting more oatmeal this morning because my husband's being amazing. So I'll update you more probably tomorrow. Anyway, that's my first couple days. A little bit of a rocky start. It's not an easy recovery. Definitely a bit worse than my C-sections, but I'm thinking it's going to be worth it. So anyway, talk to you later.